Hi, my name is Madina, and I've always disliked long intros, so here are 7 reasons why you should not go to dental school. Reason number 1, I hate the dentist. This is something that I've heard time and time again, and which you will hear all the time in private practice, or wherever you decide to practice dentistry. Patients come in with the expectation of having a horrible experience, expecting pain. A lot of this stems from a traumatic experience in childhood or even a bad experience as an adult. People come into the dentist expecting there to be something wrong. So, what do you do about it? When you hear, I hate the dentist, I've heard some of the best responses come from the dentists that I've worked with. A lot of times they go the extra mile to try to alleviate the patient's anxiety and try to put them in the most comfortable place possible by explaining everything that they're going to do and encouraging them to come in for prophylactic visits instead. This creates a level of trust and comfort at the dentist office, since every time that you're coming in, you're not having major work done. This is something that you're going to have to actively work to dispel when you become a dentist. And it's going to be difficult, but it's going to be something that you're going to hear a lot. Having worked as an assistant for a year and having shadowed in several offices before that, you can't imagine how many times I've heard patients come in and say to the dentist, I hate the dentist. It's nothing personal to you, but it's just how I feel. So you're going to have to work extra hard, go the extra mile to try to put your patients at ease. However, if you're going to find it difficult to try to explain this to patients and try to gain their trust and to bring them to a comfort level to where they want to get treatment done, then dentistry is going to be a very difficult field for you. Reason number 2. So, someone says, so what, you couldn't get into med school? Believe me, there are so many times where I've heard this from people. And for some reason, there's been this long-standing misconception that medical school is somehow more difficult than dental school, even though they're both the same length of time. They're both heavily focused on anatomy and physiology and full body medicine. And then it's just that dentistry takes a more narrowed approach to your head and neck. But a lot of times people will say, oh, but dental school is so much easier to get into than medical school. And if you are going to resent hearing that, then it's going to be pretty difficult for you going into this field. The way that I've dealt with this question is no, because I've wanted to be a dentist as long as I can remember. And this is specifically the field that I chose. It's not a second option that was on the table after I tried and failed to apply to medical school. And then this is no way disparaging medical students or people who apply to medical school, people who want to become doctors. But there is this sort of misconception that medical school and dental school are completely different, and dentists have it easier in terms of getting in and getting through dental school than med students do getting through medical school. And the length of training is the same. The intensity of the courses is very similar. And at the dental school that I'm going to be starting at in the fall, we actually spend the first year fully integrated with the medical students. So we're learning the exact same thing. And then once we start going into clinic, that's where our studies kind of diverge, which is totally fine because they will focus on full body anatomy and we will focus more on head and neck anatomy and dental anatomy and diseases and other things in the oral cavity. But if you're going into dentistry, get used to hearing this from people. People will just automatically assume, and you have to be ready to kind of dispel those misconceptions, right? Be ready to say, that it's not as easy as people think, that it takes a lot of work, it takes a lot of studying in undergrad, maintaining a high GPA, all the same things that med students or pre-med students have to do to get into medical school. This brings me to my next point. A lot of people will say, but dentists aren't real doctors. And what do they mean by that? They mean that dentists aren't MDs. They assume that just because you are a dentist or you're studying to become a dentist, that you are somehow less qualified, less educated on the afflictions of the human body. It's true that when it comes to oral health versus your overall body health, it's better to go to your primary care physician if you have some sort of internal issue that you want to deal with. But that doesn't mean that dentists don't study the full body. When in the first year or in second year you start doing anatomy, we do full body anatomy. We dissect the cadavers just like the med students do. We study a lot of the same concepts. We study diseases of the entire body because the whole body is interconnected. And when people start realizing that, that's when you kind of dispel these misconceptions. But again, you're going to have to be prepared to explain this. Another funny thing that I've heard is that there are two different dental degrees, or I should say there are two different dental degree titles. However, they're not actually different. So a DDS versus a DMD are exactly the same. It's not like in med school where you go for an MD or a DO where one's a medical doctor and one is a doctor of osteopathic medicine, and they're different in terms of how they approach medicine, how they treat patients, and things like that. A DDS and a DMD are exactly the same. But guess what? A lot of people think that a DMD is more qualified than a DDS because of the MD in the title. And I just want to be the first one to tell you, if you haven't heard this, DDS means Doctor of Dental Surgery, whereas DMD is Doctor of Dental Medicine. And the reason why the two degrees came about is because, this is a story I've heard, I don't know if this is actually true, don't quote me on it, but apparently Harvard Dental School didn't like the way that Doctor of Dental Surgery sounded in Latin. So they created the title Doctor of Dental Medicine in order to put it on their diplomas. So that's how the DMD came about, and then a few different schools adopted it. However, having a DMD versus a DDS does not make you any more or less qualified as a dentist. It also does not mean that you've had more or less full body anatomy training. That all depends on the school that you go to, the emphasis that they put on didactic courses, how much time they choose to spend, not focusing on just solely dentistry. However, at the dental school that I will be starting at, we will be fully integrated with the medical students, as I just said before, and we will be receiving a DDS degree. So just because we are spending more time studying medical concepts, not just dental concepts, we will still be receiving a DDS degree. Dentists are still doctors. If you had an infection in your mouth and a splitting headache because of it, your dentist will be the one who is equipped to treat it. They can prescribe medications, same as doctors. They can conduct treatments, and oftentimes dentists actually carry you through from start to finish themselves through treatment. Whereas a lot of times with medical doctors, your primary care physician will have to refer you to a specialist, and the specialist will have to send you back to your primary care physician, and there's a lot of handoff, which there is in dentistry as well. There are different specialties, but most of the time throughout the course of your treatment, you're sticking with your general dentist. And by the way, for those who still think that dentists aren't real doctors, I've heard this a lot as well, where people don't think that dentists have to do a residency, they can just finish school and go work right away, which is true in some states, but in the state where I live, and I live in New York, and I think California also requires a 1-year residency for general dentists. And for specialists, it goes even longer than that. If you want to be a pediatric dentist, if you want to be an oral surgeon, an endodontist, a prosthodontist, you still have to do residencies after school, which is more training, more practice before you're fully autonomous in seeing patients. It's not just you finish dental school and you go out into the world. It is like that in a lot of states, but not in all states, and especially not if you decide to specialize like you would with any medical career. So another thing that I hear all the time is people ask me, well, do you really want to work in people's teeth all the time and work in their mouths, and isn't that so gross? And my answer to them is always the same, and it's that the human body has a lot of different orifices and a lot of different bodily fluids and its fair share of pleasant things as well as some unpleasant things and unsightly things and things that can make your stomach turn, but that's what you sign up for regardless of the medical field that you go to. And it's a part of the human body, it's a part of life. You can't be going into field of medicine if you can't handle blood or other bodily fluids like saliva or vomit, which does happen all the time, adult and children, believe me, or anything like that. You really need to be prepared for all of those things, because when you're dealing with a person, a human, you have to be prepared for all of the things that sometimes come out of humans. That's normal. It's fine. It happens. But you really have to think about that. Is that something that you're really comfortable with? Are you okay with seeing blood all the time? If you're extracting a tooth and the tooth is oozing and the oral cavity is filling with blood and saliva and all that stuff, you have to be prepared for seeing all of these things all the time. You have to be prepared for patients throwing up on you, which has happened to me as an assistant. I've seen it when people were taking x-rays and having to bite down on the sensors, which are uncomfortable, and with people who have a pronounced gag reflex, they sometimes tend to vomit. It happens a lot with kids too. So it's just a part of working in medicine. You're working with people, you're working with real live human beings, you're not working on mannequins. Obviously things will happen. People will bleed, there will be saliva, there will be other bodily fluids. It's normal. You just have to get used to it. You have to get used to seeing it, and you can't be grossed out by it. My fifth reason not to go to dental school is that everyone will tell you that dental school is so expensive, and that's 100% true. I think that of all of the graduate educations that I personally know of, dental school is the most expensive postgraduate education. It really is. If you think about it, right, even medical school on average is less expensive than dental school is. And that's not even including instrument fees and other things that medical students just don't necessarily have or use while they're in school. On average, a private school with tuition and not even really including all of the living expenses, a private dental school will cost you about $100,000 a year. And that's true regarding schools that are in cities, in smaller towns. Unless you're going to a state school where you're getting in-state tuition, that's what you can expect pretty much at any dental school in the country to pay per year, which is an astronomical cost, because if you think about the average private medical school, the tuition is about 20 to 30, sometimes even 40K less, which is crazy to think about because the education that we're receiving is relatively similar, but in dental school we just have to have the clinic facilities, we have to pay for the instruments, we have to spend a lot more time in the lab facilities because we have to practice, obviously on plastic teeth before we ever touch a person. And so I'm assuming that that's where a lot of the cost comes from. But also over the past few years, the cost has also increased astronomically. Like the dentists that I work with, the ones that graduated about 15, 20 years ago, they went to a state school and they paid something like $17,000 a year for their education, which is, it's a pretty penny, it's not an insignificant amount of money. But if you think about it now, that same state school, if you were to pay in-state tuition, currently costs $40,000 a year, which is a steep increase for, the past 15 years. And if you think about the tuition of private schools, it's even higher than that. So the cost of dental school is quite intimidating. You should see the raised eyebrows that I get every time that I tell someone how much I'm about to sign up for in loans for the next 4 years of my life. It's insane. It is a lot of money and it is a steep price to pay for your education, but that just means that I'm going to have to work harder, have a plan, and have a way to pay it off as soon as I can. There are different loan repayment programs. There are things available through the Navy, the military, the Army, and some people do choose to do that, where those institutions will pay their tuition and then they have to serve for a certain number of years. I'm not the authority on this because I personally have never looked into a scholarship like that. But there are also different loan repayment programs for after you graduate, like if you choose to work in an underserved community or neighborhood, then after a certain number of years for working, let's say in the hospital system, you may be able to qualify for loan forgiveness, which is also another great way to go. Otherwise, the average dental salary for a general dentist at least in the area where I live, is high enough for me to understand that, yes, the cost of education is high, but I also understand that I can very reasonably pay it off with a steady job in dentistry, whether that's working as someone's associated first and then opening my private practice, or all the different ways that new grads will choose to work. However, if you're intimidated by numbers, get ready to be intimidated some more. On average, you're probably going to walk out with around $400,000 to $500,000 worth of loans, including living expenses, all of that, since you can't physically hold a job while in school. You've probably heard it before, you're gonna hear it again. I have personally kept around 2 to 3 jobs at any given time during my undergraduate career, but I'm going to quit all of them for dental school because that is a totally new beast. It's a totally different time commitment, and you physically can't keep a job in dental school. So that means you're going to have to take out loans for your rent, for your groceries, for any sort of miscellaneous expenses that you might have along the way, for tuition, for instrument fees, for health insurance if you don't have it, for other books and supplies and dental loops and things that you absolutely must have as a student dentist. It's a lot of money. But guess what? There's always a way to pay it off if you're smart about it, if you don't use your loan money to go on vacations, which I've seen people do. It's all about being responsible and having some sort of financial education. And I'm sure that every school has a financial aid office where individuals are there literally being paid to help you be financially responsible and gain access to your loans and make sure that you have enough to cover you throughout your time in dental school. But at the end of the day, it is a lot of money. Reason number 6 not to go to dental school is that people will say, well, the market is oversaturated anyway. There's a dentist on every corner, so what's one more dentist? Well, that depends, of course, on where you live. I live in New York City, so we really do have a dentist on every corner. But I truly believe that if you are passionate about helping people, if you have an eye for aesthetics, if you have just a passion for creating something that will truly make people smile and give them the confidence they didn't have before, then there could always be more dentists. We can always use another person who is willing to put their patients first. Because working in a private office, I've seen so many patients come to us and say, oh my gosh, I've had the worst experience. The person that I was going to before didn't take the time to explain anything to me, and I was so apprehensive every time I would go, and I would just experience horrible pain, and I was not aware of any of the side effects of the treatments, and no one really took the time to talk to me and explain to me, what was being done and what was going to happen. And that always makes me so sad, because it makes me think that these people probably had these horrible experiences, and that's why they let their situations get so bad. A lot of times when people have a terrible experience like that, they will not go to the dentist again unless something is really, really hurting them. And at that point, they could have let, even small cavities, if left alone for a year or two, get so bad that they either have to get root canals on a lot of their teeth or they have to pull them. And that's just such a sad situation, because that means that despite their best efforts, there was some sort of miscommunication issue that caused there to be a rift between the dentist and their patient. And then that patient is now worse off for it. And so I think that if I can be a dentist that can just help even one person feel better about their treatment, feel better about themselves, feel better about their oral health, and feel more comfortable to come in just for cleanings and checkups so that they don't let their situations get bad, I think that is saying something and that is doing something, and we can always use more people like that. I think it just takes one positive experience, one good interaction with a patient to completely change how they feel about going to the dentist. And the more people we have that are truly compassionate and truly caring about their patients, the better off everyone will be. And last but not least, my favorite thing to hear when I say that I want to go to dental school is, well, dental school is so many years of school. When are you going to have time to get married and have a family? Well, guess what? I work with plenty of badass female dentists who have had time to do it all. Dental school, or any professional school, is not a hindrance to having a life and a family. But another thing to keep in mind is that most of the time, this is a question addressed toward women. It's that, when are you going to have children? When are you going to find a husband and settle down? It's as if us getting an education is still a hindrance to the traditional idea that people have of families and marriage and having children. And I'm here to tell you this. I work with so many female dentists that have families, have children, are successful in their practice. Some of them are business owners, and having a long education or a longer period of training didn't stop them at all. I work with both general dentists and specialists who had to go through extra training post their dental school education and still had time to have families and children, and it wasn't getting in their way. I'm not saying that it wasn't difficult for them, because they did share their experiences with me, and yes, it wasn't easy, of course. But in general, having a child and having a family isn't supposed to be easy anyway. And yes, dental school is not easy either. But it's not anybody else's place to say what timeline you should be on. It's not anybody else's place to tell you when you should have a career, when you should have a family, when you should have children, and how long you should spend on your education. If I want to go for dental school and then I want to go for the longest possible residency training program, which is probably the 6-year oral maxillofacial surgeon training program, I can do that. And I could still have time to have a family. It's just about the sacrifices that you're willing to make. It's about the schedule that you're willing to have. It's all about you as a person. So the next time someone says, oh, but how are you going to spend this many years in school? When are you going to have a family? Just tell them that truly, and with all due respect, it is none of their business. It really isn't. And I've had to learn to tell people this and set the boundaries and say that, I can have a career and I can be successful without anybody kind of going, your biological clock is ticking, which is, I know, an older generation thing, but still, hearing it, I'm sure, is a deterrent to a lot of people, and it shouldn't be. And I will say this. I can only speak from my personal experience, but hearing things like that only shows me how proud I am to live in a generation where that's not the standard anymore. Whereas, even with my parents' generation, my grandparents' generation, it's true that women were expected to put their careers on hold in order to have families, have children, and so on. I think at this point in time, we've progressed far enough to where we don't expect that anymore. And we can have strong female bosses, we can have female physicians, female dentists, and those women can still live very fulfilled lives, whether or not they choose to have children and families. I personally do see myself having children, but I don't want to put my career on hold in order to do that. And that's totally everybody's choice. And it's nobody's place to dictate how you're going to live your life and what you're going to do, but it makes me proud to live in a society where at least I have the option. I can choose when to pursue a career, whether or not if I even want to put it on hold, whether I want to keep working and still be able to do everything that I want to achieve in life. And I think that that's saying something. So you're going to hear this regardless of the education training that you sign up for. You're going to hear that it's so many years. When are you going to have a life? When are you going to have a family? And your response should be something along the lines of, I appreciate your concern, especially if it's a family member. My grandmothers are all very concerned about my ovaries. But I will choose and I will let you know. But rest assured knowing that your granddaughter or your grandson will, in a few years, be a practicing dentist. And that's the most important part. So I hope you guys liked my intro video, and I just thought that I could offer you guys a way to respond and some examples from my life as to how I've dealt with these kinds of comments in the past. And it's easy to get kind of lost in the muck of all of the negative opinions that people personally have on a particular field. But if you're truly passionate about something, if you love seeing people transform, if you love what you do, and if you love the field, then you shouldn't let any of that stop you. And these are things that you may hear all the time, and they're not inclusive of all the things that you may hear that are deterrents for you to pursue a dental education, but there are things that should not stop you from going to dental school. And I will actually be posting a part 2 where I will tell you all of the reasons that I think that you absolutely should go to dental school, and encourage all of you if I can. So, I know I didn't really introduce myself. My name is Madina. I'm going to be a D1 in dental school in the fall. I currently work as a dental assistant during my gap year, and I just thought that I would make some videos, share my experiences, and give you guys some more information. Some other videos that I have coming up on the docket are things like how I studied for the DAT and got a 96 percentile score. Another video I'm thinking about doing is personal statement tips. Also my undergraduate education, classes to take, classes not to take, extracurriculars, things like that. I would also like to take you guys through a day in the life of a dental assistant, obviously during COVID times and things like that, and how we operate in the dental field has changed since the beginning of the pandemic. I'm also going to make some videos regarding commonly asked questions in terms of application to dental school, like letters of recommendation, what is ATSAS, how do I start filling it out, things like that. And I think that personally I was very fortunate to have resources at my school, but I would like to be a resource for all of you guys who may not necessarily have a resource at your undergrad institution, or if you're not even in college yet and you're considering a career in dentistry. I want to just have these videos up as a resource, personally just give you my experience. Obviously, I'm not an expert, I'm just a student who got into dental school and just wants to share, and also when I do end up starting school, I would love to take you guys on the journey through that as well, take you along through my 4 years of dental school. So, welcome to my channel. I hope you stick around. Stay tuned for the next video. I'm going to try to have weekly uploads, but let's see how that goes. Thanks for watching. Bye.